Analysis of COVID-19 cases in Singapore by CNA has revealed the existence of transmission hubs, including worksites and shopping centres. Now, these hubs connect larger clusters of infection. With less than a month to go before the end of an extended circuit breaker, these outbreak patterns might affect how workplaces reopen and operate. Isabel Lim finds out more.
CNA has been tracking COVID-19 cluster links since it all began with 4 cases linked to Yong Tai Hang Medical Hall. As the pandemic progresses in Singapore, the number of clusters has soared to close to 180. In mid-February, when the outbreak was still in its early stages, only 6 clusters of the virus had been identified. Links were identified between 3 of them, as thicker lines show greater numbers of cases common between clusters. 1 month later, in March, the number of active clusters had gone up to 9, while links were made between the majority of them. Fast forward yet another month, and the number of active clusters had gone up to nearly 70. A network of clusters had surfaced, connecting worksites and dormitories for migrant workers to other clusters like Mustafa Centre and Little Gems Preschool. Workplaces were found to be common links, with Project Glory seen to share cases with at least 6 other clusters. Experts say that visualizations like these help bring to light hubs of transmission.
Project Glory is a hub. It has the highest degree, and then S11, even though it is the largest cluster, it is so-called a periphery of a subnetwork. Personally, I'm not surprised because these are places where the workers go back to sleep. They don't mingle with people in other dormitories at S11 itself.
Professor Cheong warns, however, that such modelling would be open to inaccuracies, especially if asymptomatic and unreported cases are not accounted for. Still, drawing the connections can help inform outbreak prevention.
More kinds of social distancing, not just at the individual level, but the way we do business must change in order to prevent the next big outbreak. A network diagram like this is only the starting point. It is nowhere near the finishing point. So, we are not going to say that we will prevent the next outbreak because we draw a high-resolution network picture of what is happening in Singapore right now. We still need to understand the reasons why their connections exist.
Another expert says that such information may also influence the future of work.
The labor-intensive ones. Well, in the past, we have been trying to de-emphasize this and to say we should move on to new types of work like that involves mechanization, automation, computerization. But because of the low wages and the competition for, say, efficiency and low cost, we continue to bring in cheap labor because that's freely accessible. But going post-COVID-19 now, we will have to think of ways in which we can substitute the labor-intensive activities for capital-intensive ones. So in which case, then we will have to find other ways we can become just as efficient by using mechanical substitutes like automated systems and use of sensors, and for IT and AI, use more of computerization.
He adds that employers would also have to consider space and workforce segregation, potentially affecting current systems of rostering and schedules.